Thank you, and thank you, Senator, for yielding to me. The Chairwoman Romer, are you familiar? The Business Roundtable of the Business Council on June 21st sent to Peter Orszag a list of things. The letter that accompanied it says, as a follow-up to your request, Mr. Orzag's request, to both the Business Roundtable and the Business Council for examples of pending legislation and regulations that could have a dampening effect on economic growth and job creation. Surveyed our members to get their views, attached an executive summary and a detailed description of what they see as government initiatives that will inhibit growth. Paraphrasing there just a little bit. Are you familiar with this document?
I am indeed. On
page 10 of the document, in the detailed portion, about the middle of the page, there's a paragraph devoted to Texas Title V permitting and new source review. And this is a complicated subject, and I know it's not really the subject of our discussion today, but let me use this as an example of some of the things that are happening at the level of the administration that are having an inhibitory effect on investment, certainly in my home state of Texas. On March 31, the EPA formally disapproved of revisions to the Texas Qualified Facilities Exemption rule that allowed facilities to use certain types of control equipment to make changes in their operations without going through permit review, as long as these changes did not result in a net increase in emissions. So we're not harming the environment anymore, but we had some flexibility in implementing new equipment coming online in some plants like refineries that make refined product for gasoline that people depend upon in this country and need to have a stable and price-secure source. So it goes on to say continued EPA objections could delay startup of certain projects already under construction or extend the permitting process for major new projects. In general, a flexible permit can provide a single emissions cap for part of an entire facility in lieu of permitting each individual unit built within the facility. Here's the important part. Similar rules exist in other states and have not been challenged by the EPA. Is Texas being singled out here, or are other states that work under flexible permitting from the EPA, can they expect similar draconian policies to be enacted in New Jersey, Pennsylvania, other states that do refining?
All right, well, I'm not going to try to get into the specifics of that particular rule. Let me actually, though, the general issue of regulation, it certainly, as I said, we've been talking to the Business Roundtable. I think probably the most important thing in that letter was the first sentence that said, as you requested, here's the work that we've done. I think what you're seeing is there's been a lot of business outreach. One of the things that I'm at lots of meetings with are meetings with businesses.
Yeah, I don't mean to interrupt, I'm going to run out of time. But maybe we can get back to you in writing on this, but this is a terribly important point back home. Right. And the economy of Texas actually has done a little bit better than some other state economies. We're not a basket case yet, but we could be with this type of federal burden coming down on the state permitting process. We want clean air in our state. There's no argument about that. This does not increase the pollution burden in the state. We're simply asking for flexibility. And right now, you've got the governor of my state, Governor Perry, in a pitched battle with the EPA over this, and it does no one any good to do that, and certainly is doing nothing to foster job growth, not even in my district. This is down in the Houston-Beaumont area, but it's certainly going to affect the economy of our state. You talked about the health care bill, and I've just got to ask you, I mean, you don't really believe that health care bill that was passed is actually going to lower the cost of health care in this country?
I absolutely believe it's going to slow the growth rate of health care costs. Absolutely.
It is a fantasy that it really needs to be stamped out and rejected. We're through with the bill. The president got what he wanted. Let's be honest and admit we've driven costs through the roof. If you're really honest about what happened in that bill, we didn't include the doc fix in that bill. We didn't include it because it was $300 to $500 billion. When that bill comes due, do you really believe that the health care law that is now the law of the land is actually going to reduce the cost of anything for anyone in regards to health care in this country? We turn tons of regulation over to the federal agencies. No one has any idea what those rules are going to look like. Your Business Roundtable is concerned about the effect on jobs and job creation of the result of those rules. And if those rules become too onerous, employer-sponsored insurance will indeed become a thing of the past. If you like what you have, you can keep it, will become a hollow promise. And the federal government will then have the burden of all of those health care costs that the private sector is now unloading. It will be cheaper to pay the $2,000 fine than it will be to keep up with the rules and regulations that are coming out of Health and Human Services and the Center for Medicare and Medicaid Services.
Congressman, I just have to recommend that you read 3 wonderful studies done by the Council of Economic Advisors where we went through the provisions of the bill, and our analysis based on outside studies is that it will slow the growth rate of costs by 1 percentage point per year. The other thing, I think we lose sight of the fact, the reason it was as hard as it was to pass is precisely because it included some very hard things that will help to slow the growth rate of costs. The excise tax on high-price plans is something that health economists say can genuinely help to slow the growth rate of costs. The Independent Payment Advisory Board is something that we think
scares everyone to death.
We think it is something that can help to slow the growth rate of costs.
And again, my time is up, but I just have to say one thing. Richard Foster, the actuary for CMS, came up with a figure that was available before we voted on the bill but withheld from Congress that said the cost of this thing was going to be much greater than what was being advertised. I have sent letters to Secretary Sebelius. Let us see the notes and emails and traffic back and forth, what went on between the actuary and the head at HHS before we voted on this bill. Why was Congress denied accurate cost information on this bill? I have not gotten any answer from the administration yet.
Can I say you did get an answer from the Congressional Budget Office, which is one of the sources of high-quality information, and what they said, and what we based a lot of our analysis on, is that it would slow the growth rate of costs and save $1 trillion over 20 years.
To paraphrase, they said, oops, we goofed.